Okay, great. I've recorded it, so we're ready when you are.
Perfect. All right, everybody. Thanks a lot for joining us here on your Sunday evening. My name is Darren Gill. I'm the Senior Director for International Talent and Recruitment for Canadian Health Labs. Today, we're going to be discussing the UK physician pathway to Canada and kind of presenting you guys with an opportunity that we've got, giving you an overview of the process, how we go through it. We've got some great guest speakers. So I guess without further ado, we'll jump right in. Joe, next slide, please. So as a summary here, our main objective here at Canadian Health Labs is to help all medical staff and physicians that are going to be coming into Canada as part of working with us have a seamless transition over to the Canadian experience. We support through licensing, credentialing, bridging, housing, the whole nine yards. We today work and support over 8 different provinces and territories across Canada with a host of needs. And are currently contracted with Winnipeg, Manitoba, to be bringing physicians in to fill placements throughout the province, and look forward to discussing and explaining a bit more of the opportunity. Next slide. So today's agenda, we're going to cover the licensing process. We're going to cover pay structure and what that looks like, our UK timeline, kind of start a process with the application coming in all the way through planning and starting, what support we provide, give you guys an overview on Manitoba. We've got Joelle St. Vincent, who's the Director of Registrations, who's going to be giving you an overview of what that process looks like. We've got guest speaker, Dr. Sarah Rushworth, who's actually been through the immigration process and licensing here in Canada, and can tell you all about how great of an outdoor environment we have, and quality of life and all that good stuff. And then at the end, we will dive into Q&A. As we're going through the presentation, if questions do come up, feel free to type them into the chat, and we'll continue to monitor those, and they'll either be addressed through the presentation, or we'll make sure we leave some time at the end to field those questions. Next slide. So the road to licensing, obviously getting licensed as an international physician in a different jurisdiction is a bit more complex than 5 easy steps, but we've tried to break it down into kind of 5 easy steps for you. It all starts with, after we go through our application process, we start with physicians apply. And this is really where we submit all of our licensing, credentialing degrees, all of that, the specialty certificate. That moves on, and from there we would go through with our board certification process with CPSM via the registration process with Manitoba. At that point, once we receive all of the documents, we continue to advance through the licensing process and go through the qualifications review, and with the end goal of subsequently working our way through registration. So, I think that the key takeaway here is our team will be working with you hand in hand to kind of hold and guide you through the process. We'll be there to answer kind of any questions, field processes, help follow up, and ensure the application is moving through the processes as efficiently as possible. Okay, next slide. Pay structure. So within Manitoba, we have 2 forms of pay structure. There's contracted and fee for service. Contracted would be a hospitalist type role where you've got a role at a specific location you're going in. Fee for service is number of patients you see. On the right-hand side here, we've got a chart that kind of goes through national average pays for physicians across Canada. One of the things that I would draw particular attention to is within Manitoba, compared to some of the more larger cities like Ontario, BC, and others, the pay rate as an average is substantial compared to other aspects like cost of living and so on. So that bodes quite well for the province and the location. Okay, next slide. One thing that we do hear a lot of in terms of questions is things around tax and the implications of moving over. So just a few quick kind of bullet points. I guess one is a general statement. Tax rates and stuff are fairly comparable to what you'd be used to experiencing within the UK. A couple of the changes would definitely be that rather than an April to April tax year cycle, Canada works on calendar years. So that would be January to December. Additionally, Canadians do pay both federal and a provincial tax when they're going through their filing. And obviously, in terms of managing tax filings back home at the UK and as you land as a new position here and making sure that you're set up in a tax efficient manner and taking advantage of certain exemptions and things that would be applicable to your field of service. Getting a savvy tax accountant would be extremely beneficial through this process. Perfect. UK to Canada timeline. So as a general kind of guideline, we do aim to try to do this within 27 to 37 weeks. And this, of course, is dependent on you, your personal situation, when you can travel, limitations you may have. But from an overall process fee perspective, once you apply within CHL, we try and get through those applications fairly quickly as they come in. So there's about a week to go through that process. You'll go through a pre-screening interview with folks from our team where we'll help gather all of the documents and stuff that you would need for physicians apply. We will work on preparing a submission package for you to the province. We will get an initial kind of review going. At that point, we will set you up with a clinical interview where you'll actually get to meet folks from the registrar's office and folks that can provide you with a bit of feedback for both process, work life, and so on, but also check for clinical competency. As a next step with a few candidates, we've also done interviews with other physicians that have gone through the program, so you can get a sense of what their experience was like, the quality of life in certain communities, areas, so on and so forth. And assuming we're all moving forward, at that point, we go through the application process, immigration licensing, which takes about 24 to 32 weeks. And so, we are able to move fairly quick on this. Both CHL and the province are motivated to get net new physicians in, and we'll work on streamlining and making this process as efficient as possible. Next slide. So how CHL supports, a little bit of what I touched on in the intro, but we do cover the medical licensing costs. We will go through that whole process with you and guide you through the application process. We provide comprehensive immigration support. So we've immigrated healthcare physicians from multiple countries over the years. And it's something that we do have expertise on in-house and have worked with various programs to help get through that. From when you land, making sure that the pickup at the airport goes smooth, so you've got a place to go. In some cases, I joke, but we do aim to provide a level of service that most folks don't. We've had situations where we've made sure there's groceries in the fridge so you can make breakfast the next day, kind of thing. So we really do treat this as an end-to-end concierge service. And then obviously flights getting to Canada, making sure that, we're scheduling, coordinating, arranging all of that for you all the way through the process. Strangest request in my year and a half here is we actually went and got an air fryer for one of our nurses because she absolutely said she needed one to be able to cook the type of food she wanted. So, we do believe in going the extra mile for our staff. Perfect. Next slide. So a couple of pictures here of just general life in Manitoba. Lots of great community outdoor events. If you're into being an outdoorsman, if you like, having the toys, the dirt bikes, the ATVs, the ability to get out, connect with nature, wilderness, it is an absolute fantastic place to be. Great opportunity to maximize earning potential. Lots of different work throughout the province that will present itself as well. Fantastic university for ongoing training, development projects, personal projects that you may want to pursue in partnership there. And I I would say ultimately, you know, cost of living and quality of life, if work-life balance is important to you, it's a fantastic place to be. Next slide. You can see here just kind of continued on that average cost of living bit here. You know, if you look through all of the provinces and you know, what I would say are your usual suspects of Vancouver, Ontario, being Toronto, so on and so forth, average cost of living in Manitoba is substantially less, and with an earning potential, as you saw on the previous slide, that's, you know, higher than the average in some of these major cities. It leads to quite a great opportunity for that work-life balance, disposable income, so on and so forth. Similarly to that, you know, price of housing for anybody in and around downtown London, I'm sure you've all felt the pain. You know, big cities in Canada are no different. If you're going to be in the Toronto, Montreal, Ottawa, Vancouver areas versus quality of life, and you know, I think the biggest thing, again, I know I touched on outdoor living and you know, ability to connect with nature, but you know, what you can get within Manitoba for the price point is substantially more. You're talking acreage, you're talking, you know, much larger homes, and they do have, you know, everything you'd want within a big city. They've got great restaurants, great nightlife, lots of great kind of things to do. But again, that whole quality of life aspect is much more favorable. So some of the largest cities here, you know, just again to kind of give you an overview, you know, where some of the big cities will have, you know, i.e. the Vancouvers, Torontos, you're dealing with 3.5 to 10 million plus people, much smaller populations for the larger cities, which again, you know, is a fantastic opportunity to get in, know more of the community, and so on and so forth. Okay. With that, I'll turn it over to Joelle St. Vincent to walk you guys through the pathway from the UK.
Hi, everybody. I'm Joelle. I'm the Director of Registration at the College of Physicians and Surgeons of Manitoba. Next slide. Every province in Canada has a College of Physicians and Surgeons, and our main mandate is to ensure that only those who meet the established registration requirements are granted registration. Each province has their own standards, their own requirements for registration. Every province is different. We all have different legislation. So today I'm only speaking about the Manitoba requirements. Next slide. The application process, and I know this is a little daunting, and that's what I'm here to help you through today. Manitoba has various classes of registration. I think we calculated approximately 27 classes of registration the other day because our council wasn't even sure how many we have. Today specifically, I am going to be talking about the route to the recognized training route with the College of Family Physicians for general practitioners. I think probably most of you that are watching this are interested in that route, and I'm going to help you through that. I'm not sure if you're aware, but in September, our council eliminated the requirement for the LMCC for any type of registration in Manitoba. So it's one less examination that you have to apply for, sit, or have before you apply for registration in Manitoba. Next slide. To be eligible for provisional registration through the recognized training route, there's not much. You have to have a medical degree, nationally approved. You have to have a confirmation letter from the College of Family Physicians. I'll get into that in a little bit. And meet the current language proficiency requirements. UK is an exempt country for having to take any of the exams, so you shouldn't have to worry about that if you've done any training or practice in the UK. Next slide. So we have simplified the registration process into steps. And step one, and Darren already alluded to it, get your documents into Physicians Apply. If you are even thinking about have any interest in applying for registration in Manitoba or in Canada at all, everybody across Canada is going to require this, except for Ontario. They have their own source verification system, but get them in now. It's just your medical diploma, all your postgraduate training. If you've applied for Physicians Apply, probably in the last year, it has been a little bit daunting and it has taken some time. We've been assured from the Medical Council of Canada that they are back on track and that the source verification shouldn't take as long as it has been in the last year. Also, CPSM, myself specifically, if you have your documents in and they're taking some time, just let me know and I can expedite them. So it shouldn't be a part of registration that takes too long or too daunting. We work very well with the Medical Council of Canada. Once you get your documents into Physicians Apply, contact the College of Family Physicians of Canada. If you've trained and practiced in the UK, it shouldn't be difficult to get a letter from them to say that they recognize your training for registration purposes in Manitoba. We have a very good relationship with them. They usually take maybe a week to review and get us that letter, and they'll send us a letter directly. Step 3 is ensuring that you have an employment opportunity. You don't have to have employment offered to apply for registration in Manitoba. You can apply at any time. However, what you should be aware is our applications are only valid for 6 months. So if you think that you're going to be not wanting to even remotely relocate to Canada for another year, you can start in the process with Physicians Apply and the College of Family Physicians, but don't submit an application yet because we're just going to have you fill out another application in 6 months. Next slide. Now, as soon as when you apply for registration through the application for medical registration, that's through physiciansapply.ca. That's the same place you'll be sending your documents for source verification. So you'll already have a file with them. So you apply through them. Manitoba has a review of qualifications. It's a part 1. It's cost effective rather than completing the whole application, spending the money for the entire documentation, only to find out whether or not you're eligible for registration. The Medical Council of Canada reviews gets the applications and sends them to CPSM twice a day. So overnight we get your application, we review it. Pretty much we'll acknowledge your application within the next 3 days. Usually it's same day. When you apply for registration, right from the time that we open your review of qualifications, whoever it is, your review analyst will be with you for the duration of your registration in Manitoba. Therefore, you have one person to talk to. You'll get the same information. You'll get consistent information. They will develop a relationship with you and you can talk back and forth rather than going amongst the entire staff. So within 3 days, a review analyst will contact you and you can see the list. It looks a little bit daunting, but basically it's forms that we send to you to sign just to get the application process. So we're going to ask you for 3 references, 3 referees. We will send our own document to your referees. We'll ask you to sign an undertaking for criminal record check. The reason we ask you to sign an undertaking is because sometimes criminal record checks can take a little bit of time. We want to make sure, let's say you beat your criminal record check. Let's say your application process is going really, really quickly and we have you registered within the month. If we don't have your criminal record check, if we have your undertaking, we can issue registration without your criminal record check. Your MINC consent, that's your medical identification number for Canada. We just have you sign a consent that we can issue you one. We want a consent to release information. Therefore, when you're working with your recruiter, we can give them any information at any time, exactly what you would receive. We can copy them on all correspondence. So that way you have the same information. Your recruiters have the same information in real time. We'll have you sign a physician's apply undertaking if you haven't submitted your documentation yet. Most have, but just in case you haven't, then we can proceed with your application that you've signed that you will undertake to do that. And most important, we are going to require a certificate of good standing from every licensing authority you've ever either trained and or worked in. Again, I wouldn't request those until approximately 6 months before you decide to come because they can expire, depends from each licensing body. Next. If there's an offer of employment and we receive all the documents on the previous slide, we will enable you to complete part 2 of our application. And part 2 of our application is just basically the personal questions. You don't have to do anything, you just have to answer the questions. Once we get that, and even if you don't have an offer of employment, we will still communicate with you. But if you have an offer of employment, as you can see, we will require a few additional documentation. You'll be required to have professional liability in Manitoba. Usually physicians opt to go with our Canadian Medical Protective Association. They're very familiar with us. Basically, they'll just want to know when you're going to start. They'll work with you the day that you get registered or the day that we issue your registration number. You let them know when they issue you your insurance. We require certificates of professional conduct, criminal record check. You'll have to provide identification. Now we know with identification, immigration. So a lot of the documents on here aren't going to be required until you arrive in Manitoba, such as the liability, your work permit if you're coming in through immigration, your practice location, and your fees. Your fees don't have to be paid until you're going to be starting practice. The Minister Certificate. So what the Minister Certificate is in Manitoba, the Minister of Health has to approve all international medical graduates coming to Manitoba and where they work. So if you're being recruited to the Interlake Regional Health Authority, Manitoba, or the minister will know that there is availability there. We send a request for the Minister Certificate. You don't have to do anything with that. And once it's approved, they send it back to us. We've never had an issue with the minister to date, has never denied a location that a physician is applying to. So it goes fairly smoothly. The only thing we need for that is your practice agreement. And your practice agreement, if you're coming through the recognized training route, means we get a letter from the College of Family Physicians indicating that you're eligible for the CCFP exam. That's the College of Family Physicians exam. Because you don't hold certification, we have to register you as a provisional registrant during that time. Once you're registered, the College of Family Physicians, all they want from you is a certificate of professional conduct from Manitoba. So the day that you get registered or the day after, you can apply for a certificate of professional conduct from Manitoba. It's on our website. It's an easy process. You can apply for it immediately. Once the College of Family Physicians receives that, they provide you with College of Family Physicians certification. As soon as we get that, and it's often within the week of registering you, you get full registration. So provisional and the Minister Certificate is only for as long as you want to continue your provisional registration. If you request that certificate of professional conduct right away, you'll get full registration. We will also provide a letter for immigration purposes. However, we do need to know that you require one because not all physicians coming from overseas require immigration. Some have Canadian citizenship. We don't know. As soon as we determine that you're eligible for registration, we can provide you directly with the immigration letter. Next slide. So here's a quick guide, just for seeing that it is quite easy. You submit your documents to Physicians Apply. You contact the College of Family Physicians. You apply through the Physicians Apply for registration, review qualifications to us. You complete your application. You get provisional registration. Request the COPC from Manitoba. Goes to the College of Family Physicians, they provide evidence of certification, and you have full registration in Manitoba. Next slide. Thank you.
Hello. Darren, do you want me to just start?
Yeah, sorry guys. Thanks a lot, Joe Ellis, for that. And then Dr. Sarah Rushworth will kick us off on her experience.
Hello, UK. Good evening, everybody. I hope you're all doing well and staying safe. I know there's been some storms over there as well. So I've been kindly asked to just tell you a little bit about my journey from a UK GP perspective. And I arrived in Canada in July 2021. And the tagline of one husband, two kids, four bags was very much how we arrived. And that was all I brought with me when we came in July 2021. And so certainly you can see us on the plane, and that was us in July 21 boarding our flight. I am actually located not in Manitoba, although it looks very, very nice from all of the photos I can see. I'm actually in Nova Scotia, which is one of the smaller provinces. And we're going to tell you a little bit about sort of my journey there as well. Next slide, please, Joe. So a little bit about my background. I'm a Liverpool University graduate. I started off as a gastroenterologist and then decided to join the dark side and become a GP and started training in about 2011, finished in 2015. And then I've worked in lots of different roles in general practice in the UK, salaried as a locum and as a GP partner, and did some extra little bits along the way as well. I did some medical writing, some GP mentoring for the university, some examining for the university in medical school intake, and also had a special interest in children and adult safeguarding. And just before I came to Canada, I was the named doctor for children's safeguarding at Mersey Care Trust, which was a privilege. Next slide. So why Canada? People always ask me, what made you decide to come to Canada? And I find it really difficult to answer. Doing this presentation was actually very helpful. And I had a few sort of notes which were given to me to say, 5 things, what is it? And just naming 5 things is very, very tricky, but certainly, I'd heard a lot about Canadians. I'd heard they were very welcoming and very kind. And I can absolutely say on arrival here, that is absolutely what we got. We are very fortunate where we live. We have an amazing community. People are kind. People are very grateful for you to come and be a doctor in Canada. There is a shortage of doctors. It's slightly different to the UK, where basically if you have your catchment area, you go to your local GP. It doesn't quite happen like that here. Certainly in Nova Scotia, there's many people who do not have a GP, so GPs are in high demand over here. I think from a UK point of view, I know you're all doing an amazing job in very, very difficult circumstances. And one of the things that we always think is, gosh, is it any better anywhere else? And what sort of things do I want to do for my family? What sort of life do I want to have? Am I going to be able to keep working, certainly in general practice till I'm 68? Or am I going to burn out before then? And I think certainly for me and for my family, I really felt that Canada would offer us new opportunities, and hopefully for me would be sort of a step back from being so busy, and would give me more time with my family. And certainly where we live, I feel there's more opportunities for our family over here. And we have a variation of weather. It is snowy in winter, it is cold, not as cold as Toronto or Alberta or other places, but it is cold. Summer, even though last summer was not great, mostly the summers are beautiful and you can have beach days and there's lots of trails and things. And you will see that money is definitely not in my top 5 of why Canada, because certainly in Nova Scotia, we've got one of the highest tax rates. And remuneration for what we do isn't as high as it is across a lot of the other provinces. But I think you have to certainly balance that against what do you want. If the idea is that you are coming to Canada for the money, I'd probably just have another little think about it. It's not all roses and lots of money. Certainly there is more money than the UK, but certainly I would be coming to Canada for the experience, the opportunities, the lifestyle, the community rather than the money. Next slide. So the healthcare system here is similar. Every province is slightly different, and I can't speak to what it's like in Manitoba. I speak to what it is like in Nova Scotia. The majority of healthcare system here, it is publicly funded, and what all the residents have is they have something called a health card, and this entitles them to consultations on an emergency basis in A&E or the Emerge, in a walk-in centre or with their family doctor. And that also covers them for referrals to specialists. So if you see a person in your GP practice and you think they need to see a cardiologist or a gastroenterologist, just like the UK, you would do a referral and they would be seen under the same route, and it doesn't cost them any money to do that. Things that do cost them money are more services with allied professionals. So physiotherapy. So in the UK, most physiotherapy is not private. You do a referral into your local MSK unit and they get seen by physio. Here, there are many, many physiotherapists who offer specialist services, and patients use their health insurance or their benefits to get to access some of these services. And usually you would have health insurance or health benefits through your employment. There is some programs which you can buy into privately as well, but these are limited. And at the moment, there are very, very limited private medical services in Nova Scotia. There are a few companies popping up which are offering MRIs and echoes and ECGs privately, and there are a couple of private ophthalmologists who will do cataract removals and dermatologists who will do sort of lumps and bumps removals. But there's no sort of direct referral through to a private cardio or a private gastro or something like that that I know of in Nova Scotia. And there are similar problems to the UK in Canada as well. You know, everyone wants more money. Public health needs more money. The Canadian healthcare system needs more money. They need more doctors. There can be long waits. COVID did the same job on Canada as it did on the UK. But I will absolutely say, if you pick up the phone just as you would do in England, they are excellent. I have never had any problems getting a patient who needs to be seen. It is exactly as you would do in England, where if you think someone needs to be seen, you pick up the phone, you ask for who's on call, and you speak to them, and in they go. And so access is the main problem to GPs for people who certainly live in Nova Scotia. There are walk-ins, but they get filled very quickly. And obviously the emergency system is under an incredible pressure here because obviously there's a lot of people without a family doctor. So if you truly want to come and absolutely make a difference and be a GP over here, I know Nova Scotia as well as Manitoba would be very, very excited to have you. Next slide, please. So when you arrive, oh my goodness, firstly, I will tell you now, you feel like you're hemorrhaging money. It feels like everybody wants some money for something, from registration to we have Doctors Nova Scotia, to your the college, to the Canadian College of Family Practitioners, getting set up with everybody. There are all things that you need to start getting set up, bank accounts, getting social insurance numbers, doing lots of things like that. So there is life admin as well as professional admin, and it feels absolutely overwhelming at times. Bringing things with you is a question I often get asked about. And when you come, obviously, you know, unless you've been very, very organized and you know where you're going to live and you know what sort of shipping container you're going to have to bring all your bits, I would bring your basic things. You know, bring a stethoscope, bring an otoscope, bring what you would bring if you were going on a house visit to someone. And then obviously, if you're going to have any sort of IT things, bring your laptop. You don't need much more than that. The clinics will provide things. You can buy, they have shops here. You can buy things here. It's okay. So don't worry about packing all your bags full of everything. There is stuff here. Bring a B&F. I always use that. I know it's different, but it's helpful, I find. There are different health authorities. So in Nova Scotia, we have the Nova Scotia Health Authority. There are lots of things like CAMPA, which is the medical indemnity. So there's lots of leftover bits, which Joelle was talking about, saying, you know, actually some of the stuff you cannot do until you get here. Don't worry, don't panic. It will happen when you get here. It feels like you're coming and you've got nothing organized, but I promise you, the first couple of weeks here, all those little bits will just get boxed off, and you can do it. One of the important things to try and get on straight away, and this is more of a clinic thing for when you are in your clinic, is to get your billing numbers. You will need business arrangement numbers and billing numbers, because this is how you will get remunerated, but it takes time. I think I was here for maybe about 8 weeks before I got paid. So you need to make sure, you know, you get onto that straight away. We have software systems here for patient charts and patient documentations. I don't think they're as good as EMIS-Web, or I know some people use System 1 or Vision. I don't think they're as great as that. We have something called MedAccess. There's something called Accuro as well. Different places have different software systems. They're okay. It's just another software system to get used to, and you get used to it and you find your way around it. And you need to also find a way of getting your patient results electronically as well, because you don't want lots of bits of paper flying around. But these are all things that your clinic will help you with, and a good clinic will help you with all of these things. And it's important to really look around for what clinic you feel is going to support you best when you get to Canada. Next slide, please. So what makes a good clinic? So you want somewhere where you feel you're going to be supported, because obviously coming here and not knowing how the system works and maybe not knowing anybody else around you is a big thing. It's a big ask. So I would suggest, if you're going to pick a clinic, if you can see it first, then that is a really great advantage. And I know sometimes different provinces offer location sort of visits where you can come and be shown around a few different clinics and chat to different people. And I would absolutely do that. I would absolutely chat to people and find out who runs the clinic, who potentially would be your secretary or your MOA, medical office assistant, you know, what they're going to do for you, who's going to do your billing. Are you going to learn to do it yourself, or do they have somebody special to do your billing for you? I would, you know, see if you can see what room you're going to have. You know, does it have a window? It's things, little things like that make a difference of how comfortable you're going to be in your clinic environment. How many doctors are there? Are they doctors who have been doing this for years and years and years? Are they Canadian doctors? I was very lucky at my first clinic. I had a wonderful, wonderful Canadian doctor who'd been doing general practice for years in Canada. And as somebody who didn't know their way around the system, I could just knock on his door and say, Peter, I don't know what to do with this. Who sees this? Where does this go? And so having somebody there is really important. And having somebody local is also really great as well. if you have somebody who's been through what you've been through as well, then that's an added advantage too. So I would certainly, you know, shop around with your clinics, make sure you have a contract or you've seen a contract with them, make sure it's very transparent, make sure it goes through everything of what is expected from you, what you expect from the clinic, and that it reflects whatever payment model you're going to be on, because your contract may vary depending on if you are fee for service, where basically you see people, you get paid, or whether certainly in Nova Scotia, we have something called an LFM, longitudinal family model payment, which is based on how many patients you have and how many hours you work, and a little bit on your billing as well. So it's just a little bit more of a complex payment model. But it's important to work out what you're going to get from your clinic, what you're going to put in there, and what they're going to get back, because clinics are businesses. And you will, most clinics charge what they call an overhead here, and that should reflect of what's included. So typical things that overheads include are your medical equipment in your room, so your couch, your desk, your chair, you know, the things that you use there. So ear tips for otoscopes, little pieces to go on your thermometer, things like that. Also, it includes your secretary, so your MOA, so whoever's going to be managing your schedule or answering your phone for you, who's going to be doing your billing. So you want to make sure that what you're paying is fair. We all want money, and clinics want money too, because they were a business, and so you need to make sure that what you're paying is a fair reflection. And you can get an idea for what is sort of a fair arrangement by, you know, speaking to different clinics, asking what their different overheads are. Do they charge a percentage? Do they charge a fixed rate? So and looking at what do you think will work best for you. And you are a commodity, you are in demand, and there may be some negotiation room for you as well. So don't forget that, you know, you can say, well, you know, I think this is fair or this isn't fair. And so certainly, you know, do have that discussion with the clinics. Some clinics have collaboration practices, so they may have a nurse attached, and that may mean some clinics may you may get paid more. Some health authorities give you extra if you work in a collaborative. Some health authorities absorb that and they use it as part of your payment model. Some clinics have walk-ins attached to them. Others have an arrangement that you do a duty doc sort of system. Some have out of hours. And so certainly make sure you know what your clinic offers and whether you're going to be part of all the things your clinic offers, and if that is included in your contract. You don't want to turn up to a clinic and then them say, oh, by the way, you're rotated to do that walk-in clinic tomorrow. You want to know exactly what you're coming into, just as you would when you go and you look around a practice in the UK and you see what is expected there. And also an exit plan, because although there's many doctors who come to Canada and they love it and it is wonderful and you want to stay and it is brilliant, sometimes things happen beyond our control and it's not for everybody. And you may want to go to a different province. You may want to go somewhere else. You may want to go back to the UK. So make sure that it's very clear, you know, what your notice period is to the clinic and to the health authority and to any contracts that you've signed. So some health authorities and provinces want a return of service agreement. Certainly mine was 2 years with Nova Scotia. And so it's important that you make sure that you've truly read all the things you sign, so that you know what you may be needing to manage if things don't go as expected. Next slide, please. So like we were saying, lots of things to look for, lots of things to organise when you get here. Bank accounts, cars, home. Banking is not the same here. It is a bank accounts, well, bank accounts for physicians are usually negotiable and free, but the whole banking process, it's a new thing to get your head around. Cars, bring your no claims bonus if you've got all that information at home. Bring everything, that sort of documentation with you. Houses, certainly in Nova Scotia, rental prices are quite high at the moment. Property prices are going up, dependent on where you live. If you live in a more rural area, you are going to get much more bang for your buck. If you live in a much more urban area or a very popular area, it's going to be more expensive. And schools, if you've got children and they're coming with you, the public school system here is based on catchment area. So certainly where you live determines which schools your children will go to. There are private schools available in Nova Scotia. My children go to our local elementary school, which is just down the road from our house. We're very happy with it. It's fabulous, and it makes us feel more of our community as well. But obviously that's a personal choice on your education. And lifestyle, there's lots to do. And everybody sort of sells the great outdoors, and there is a lot to do outdoors. There's also a lot to do indoors as well. There's lots of activities as well. So if you are not an outdoorsy person, which I am actually not an outdoorsy person, I hate going outside. If somebody said to me, "Oh, would you like to go for a trail?" I'd say, "No, thank you. I'd like to stay inside." But there's lots of things. There are theatre, there is music, there is ice hockey, which is inside, even though it says ice hockey. There's lots of things you can go and be involved with, and there's tons of activities for kids. Every area is different, but there's tons of opportunities for them to help friends. And you can see in the photo there, this is our Santa Dash on Christmas Eve here last year, whereas myself and some of my running mum friends, we went and did a 5K for a charity in the morning, and then celebrated with a hot coffee afterwards. Next slide, please. So in summary, that is Peggy's Cove at the top, by the way. It's very, very famous in Nova Scotia. It's very, very beautiful. Definitely see it when you come. I would think, why are you doing this? What is it that, you want to move for? Where in Canada do you want to go? Every province is very different. You need to make sure you pick the right one, because each province will have its own way of doing things. It will have its own college of physicians and surgeons. It will have its own slight differences in documentation it needs, and exams and registration it needs. So, when you decide where you want to go, that's when you would, go for that college. And are you sure? Are you all in, or are you hedging your bets? Do you think you're just going to go and see what it's like? And how long do you need if you just come in to see what it's like? I would say you're going to need at least 18 months to 2 years to truly, truly give it a go, rather than just come in, because if you just come and think, oh, first 3 months is awful, it's a lot of change. It's a big decision. So, sometimes people just hedge the bets on it, and sometimes people go all in. So it's a tricky thing. And also have an exit plan. So if it does go wrong, you've got, what you're going to do. And what if it all goes right? How amazing. What a brilliant move you've made. How brave you are. And come to Canada. It's fantastic. I won't go back to the UK. Thank you very much, Darren. I'll hand you back for questions.
Perfect. Thank you very much, Dr. Rushworth. So I've been going through the chat on the side here and have seen folks starting to load in some questions. So I'll just try my best to either answer them or direct them to the right person. But the first question I see here is there a requirement for a minimum amount of time on the UK training side in order to begin Canadian GP registration? So Joe, maybe if you can help field that one.
Sorry, can you repeat the question? Is there amount of time of training?
Yeah, is there a minimum amount of time they have to practice in the UK?
There's not a minimum amount of time that you have to practice in the UK if you are applying through the recognized process through the College of Family Physicians. If you meet those requirements, there doesn't actually have to be any practice.
I think part of that question, Darren, was there a minimum amount of psychiatry training that had to be done? To my knowledge, there's not. You will get asked to list all your rotations for your postgraduate training through the process. But as far as I'm aware, they don't say you must have done 4 months of psych or 6 months of psych or any psych. I think as long as you have got your MRCGP or equivalent, and you've been recognised by the Canadian College of Family Physicians, I don't think they stipulate you have to do a certain amount of psych training.
In Manitoba, you don't. I do think that there are some provinces, I think Saskatchewan is one of them, where you do have to have psychiatry training in your rotations, but Manitoba, you do not have to.
Down here. Are there any exams for which are a requirement for obtaining a license? For example, MCCQE1. Joe.
Manitoba just eliminated the LMCC for any type of registration. So you don't need the LMCC Part 1, Part 2, evaluating exam, you don't need any of that.
Perfect. Next question here was around the contracted versus fee for service, and maybe Dr. Rushworth jump in with your experience here as well. But effectively, the contracted rate is also, what every province has its own terminology, but it can be referred to as a hospitalist role. Effectively, you get paid for a fixed amount of hours for going in, and as I think Dr. Rushworth had pointed out, there could be other things like minimum number of folks you see and other kind of percentages. A fee for service is exactly what it sounds like. You get paid on a per patient basis for services rendered. And then typically that's done in more of a private clinic setting where things like overheads and so on do come into play as well. And so, don't just purely take the gross number that may sound more attractive. And I know there was a host of folks that had asked around average kind of services. So the average across Canada is between 30 and 35%. Again, Dr. Rushworth, if you don't mind touching on that as well.
Sorry, the average of?
The average for overhead.
Oh, the average for overhead. It varies. It varies from province to province. It varies from clinic to clinic. Nova Scotia, before the new payment model came in, I think the typical overhead was somewhere between 20 and 30%. It can be more than that. It can be, in the middle. It depends what you're getting. And I think that's what you really need to know is, what do I get for the money I am paying? And if it's a percentage wise, is that a fair reflection of what I should be paying? Or should I have a fixed rate? And it would certainly be something I would sit down and I would discuss with your clinic so that you've got a clear idea of what the expectation is. And then talk to other doctors in the clinic. There's nothing to stop you saying, what do you get on your overhead? What do you pay? You can certainly, you're fact finding, you're deciding if this is the right place for you. So do your due diligence and go and ask people.
Perfect. And another question that came up several times was, in order to get tax efficient in Canada, and again, Dr. Rushworth, this is specifically directed at you down below, are you set up as an incorporation, paid into an incorporation, and when you arrived in Canada, did you have any issues setting that up? If so.
So I incorporated about 3 months ago. So the first sort of near 2 years I was here, I was not incorporated. I was what you would be considered as in the UK as a sole trader. And it very much depends on how long are you here for. For me, I didn't want to get incorporated because I didn't know, from the start, because I didn't know, am I definitely going to be here for the long haul? And I didn't want to go through all the expense of incorporation and everything else. So you would pay more tax than you would as a sole proprietor than you would as an incorporation. However, when you first arrive here, for the amount of money that you are having to put out, you're not going to have enough money in your corp to probably get the benefit of saving for tax anyway. So unless you are incorporated in the UK already and you're just going to shift a corp over with funds, I think certainly get an accountant when you get here, have a good discussion about, is it worth incorporating right from the start? or is it better and more tax efficient to actually see how you go, see what money is coming in? You don't need PR to get incorporated. You can be incorporated without PR. But certainly, if you do have permanent residency, you will get better rates on other things as you would if you were just here on a work permit. So it's certainly worth applying for PR and getting the ball rolling on that if that is something that you're interested in doing, or you think that you're going to be staying here. Because if you want to buy property here, if you want to go into sort of stocks and shares and investments, you will sort of get better things if you've got PR.
Perfect. And I did see somebody asked about tax rates as well. Corporate tax rate in Canada is 25%. So anything within the corporation would be taxed at, and the balance would stay unless you're paying yourself out as a dividend. And again, you'd get an accountant and get the appropriate tax advice there. So I think we've answered that one. Again, average overheads, I think we heard Dr. Rushworth say 20 to 30%. The national average is 30 to 35 right now. But again, I think that the importance to stress there is know what you're getting for that overhead fee. And that can vary greatly depending on the level of service you're getting there. Another question, is there an age limit? I guess don't fully understand the question, but we wouldn't rule out on age as long as you met all the qualifications. Is there an opportunity for clinical pharmacists? I think that's something we would discuss through the recruitment process. We have run into this situation before where a spouse or a significant other has either a role in the medical industry or an alternative industry, and we do on a best efforts basis try and work to guide couples through the process together. And point folks in the right direction. But anybody within the skilled fields, there is usually opportunity within a lot of the similar provinces you'd be looking at moving to. Can I work in A&E as a A&E doctor while working as a GP?
Yes, you can in Nova Scotia. There are lots of family doctors who will go and work in the local emerge as well. But you would need, if you wanted to do that, you would need to make sure that that is agreed with the health authority and the college, and that you've got the appropriate qualifications and registration to do that as well, because the college and the health authority will grant permissions of where you can work and under what sort of circumstances you can do. So you can blend your practice as a GP and with ER as well. You can also blend as a GP and provide inpatient services for hospital as well. You can do long-term care facility work as well as doing GP. Depending on what your qualifications are in the UK, there is potentially opportunity to work alongside some hospital specialties too. But again, I would absolutely discuss it with the college and the health authority to make sure that you've got all your right paperwork in.
Joe, did you have anything to add there?
The only thing I would add is if you're going to be taking a job in rural Manitoba, there will be most likely an expectation that you will work in the emergency department.
Perfect. Another question here, if you decided to return to the UK, would the income in Canada be taxed again? So very similarly, if you had a reporting period in the UK coming over here, it wouldn't be taxed again. There is a tax treaty there. You pay tax in one country, not both. If you reside in Canada, would it be possible to get citizenship? Absolutely. As you go through the process, you could apply for PR and ultimately citizenship as well. So I'm just going to read the question here. I am a Canadian citizen who's completed internship, have done a year abroad in the UK, have completed year 2 in the UK, and I'm about to enter GPST. but still not specialized as a GP yet? Is there a route I can take in getting into training and working within Canada without having to take the required QE1 exams?
The short answer is probably no. You'd have to go through probably CALMS and matching, and you'd need to complete a residency in family medicine, I would imagine. If you're just going into GPST training in the UK, I would do your 3 years and then come. It would be quicker probably, because I think trying to match and trying to go through the CALMS process, I have med students doing this at the moment and they are like, oh, it seems like it is a horrific experience trying to do matching. So if you're not qualified as a GP yet, then you would then be going into the pot with everybody else who is applying for a residency program in Canada, and then also people who are wanting to come from outside of Canada into Canada. So although you've done foundation training in the UK, it's not going to get you any quicker into GP training here. You'd have to go through the residency program here.
I will add that I believe that CARMS, which is the Canadian Resident Matching Service, do require the LMCC Part 1 for international medical graduates.
Next question I see down here, I think we've answered a couple, is what about pension?
Pensions, so you've got the Canadian pension, so which you would when you do your tax return on your personal taxes, you automatically usually pay into the Canadian pension, I think. I don't think there's an option of opting out. I think it's sort of a mandatory thing, but it's only a minimum amount that you put into the Canadian pension. I think it's something like $6,000. It's not very much. So if you want a pension plan, I think I would advise that once you get over here and you've got all your bank accounts set up, I would either chat with a financial advisor, and I would then, or chat with somebody like MD Management or someone like that. And I would have a discussion then about what you're going to do for your pensions. There are tons of acronyms that I've got no idea what they mean, like RSPs and TESPs and TFRs and all this. It's another language that you have to get your head around. But if you have a good financial advisor or a good personal banker, they will explain all these things. And these are all ways of paying into, not programs, but paying into sort of accounts for the future, basically, for savings accounts and saving things for your kids. There's education ones where the government will put some money in as well. And then there's ones that you can pay into. There's ones which you can cash if you're a first-time home buyer. There's and they go in tax-free. So if you pay your RSP, you can put that money in, and that will not be counted against your personal tax. That money gets taken off. But when you take your money out of your RSP, that's when you'll get the tax on it, from my understanding. But I'm definitely not an accountant, and I would definitely say get some financial advice on pensions.
Yeah, and I think this goes back to the importance of getting a good accountant and financial advisor when you do get here. We have tax-free savings accounts, but even that, the difference between setting your child up as a beneficiary or a transferee has implications on transfer tax in the future. So there's a lot of things and nuances that you definitely want to work through. But to Dr. Rushworth's point, there's also a lot of great opportunity where you can leverage those accounts for investments and other purposes, and you will not pay taxes on the gain until ultimately you withdraw that money sometime in the future. Joe Ellis, this one's probably for you. Can you explain the expedited pathway to Manitoba, where the MCQ E1 exam is waived? Does it give you a restricted or a full license?
If you have the MRCGP and you have College of Family Physicians eligibility, you don't need the LMCC Part 1 or anything for any type of registration with the College of Physicians and Surgeons.
Perfect. And then we've got a few more here, but I think I'm being flagged for the last question here. So try and get to the bottom, see if there's something we haven't answered. This is potentially a good one. Is there a fixed time for consults, 10 or 15-minute appointments? Do you decide this for yourself?
I have 15-minute face-to-face and 10-minute phone consults. It will be how you work and what you're used to doing, and you would set up your schedule with your clinic, and you would agree on what your schedule is going to be. If you want to do 10-minute face-to-face, that's fine. You can do that. If you want to do 5-minute phones, you can do that too. I like a bit more time. There was a question about how many people do you see in a day? 25, 30, maybe. It depends whether it's a busy day or not. But there is flexibility in your schedules, and you have ownership of your schedule.
Perfect. Phil, maybe with that, I'll hand it back over to you to wrap up.
Hello?
Hey.
Great. So I think there's been a lot of questions, Darren. So I think we've got the email address there. So if people do have questions that weren't answered today, then please do email info@canadianhealthlabs.com. I'll repeat that. It's on the screen. If you do have any questions that we didn't manage to answer today, we've run out of time. It's info@canadianhealthlabs.com, and one of the team will be able to pick up the question and write back to you with the appropriate answer. I don't know, Dr. Rushworth or Joelle, if you want to provide any contact details for your respective organizations, if candidates do want to talk directly to you, ask questions about clinical practice, or if you have any Facebook groups, then maybe you can recommend that. But we will send follow-up emails to everyone afterwards so that you can watch this. If you have joined late, we will be putting it on our YouTube channel. So if you did join late, it will go on YouTube afterwards. That concludes the webinar for today. Big thank you to our host from CHL, Darren Gill. Big virtual round of applause, or you can use a reaction and do clapping. A big thank you to Joelle, who is from registration at Manitoba. Big virtual round of applause. And a big thank you to Dr. Sarah Rushworth, who is a GP in Canada, they've all given up their Sunday afternoons to be here. And thank you everyone for participating. Without you, we wouldn't have made this happen. So thank you everyone. Give yourselves a massive virtual round of applause for joining. We will be doing more events, so please keep an eye on our social media, keep an eye on your emails. We will be doing follow-up events with other people to provide you more and more information. Thank you very much. We're now going to close off the webinar. Thank you.